Hello, and welcome to another edition of Nurses Out Loud. I am your host, Nurse Jodi O'Malley, and today you're going to be listening to part 2 of our discussion. I kind of did this one a little different. I was going to put out our show on the flu as a special episode. We had one of our listeners send us in the flu declination form that they received at work, and they were having some serious ethical dilemmas and also scientific and ethical dilemmas in signing it, and they wanted our opinion. And so Nurse David, Ashley, and Michele joined me in this conversation where we broke down the 6 talking points that they wanted you to check each box and gave us their opinion. Well, what wound up happening on Friday last week was the announcement of Robert F. Kennedy Jr. taking over as Secretary of the Health and Human Services Department. And we absolutely could not let that one go without acknowledging how excited we were. I will speak for myself primarily because I did do part 1, my opinion on it. So if you want to go back and listen to that, that'd be great. But at the end of this show today, I want to remind you that this was pre-recorded. This was pre-recorded before we even knew the result of the election. Okay, we did not know that President Donald J. Trump was going to win. And what we said then, we still stand behind today. I think, guys, we have to understand that, first of all, no one is coming to save us, okay? We need to make sure that we keep our eyes on the Lord and that we are doing everything we can to be used according to his purpose. You know, our Father's will be done is way more important than anything else in our life, and certainly has given us a perspective that we have really been aligned with, I would say, for at least the last 4 years here. And to see how the Lord has even brought the nurses into my life has just been amazing. And you wouldn't have Nurses Out Loud, right? I mean, you guys, we're getting over 500,000 listens on our show a month. And that's with just us doing the advertising and marketing, and also our amazing America Out Loud platform. We have a lot of great shows. Guys, you know, there's 24/7 programming on here. I enjoy listening to it on the America Out Loud Talk Radio app. You can also listen to it live on, the shows on iHeartRadio, and then all of the shows go to podcast as well. So, but I download the America Out Loud Talk Radio app, and I can listen 24/7 to programming. So I encourage you guys to do that. I also want to let you know that our website, nursesoutloud.com, is live. And we have some fun swag that you guys could pick up and, just represent, at work. We're going to be adding like coffee cups and mugs, but we have some hats and shirts and sweatshirts. So check that out and support us that way. You can also get to each of our individual websites and what we're doing on there through the app as well. And don't forget, guys, we have Functional Nurse Academy and Remnant Healthcare and My Truth Movement. Nurse Ashley has some VAERS training, moral injury courses. Nurse Michele has wonderful advocacy and nasopharyngeal sanitation. And Nurse David, just go and check out all of us. We are very excited to be a resource for you guys. right? At the end of this show, I do want to briefly touch on this. I said that people had asked, and we had discussed what we think is going to happen with the election. And I told people, and I've been saying this for years, that I feel like we are in the end times. And I honestly didn't see this playing out as wonderfully as it has so far, with all of Trump's appointments, with no one really talking about like coming at him, suing him. I don't know. I haven't really seen all that. Although I am celebrating my 50th today. Okay. So, and my son turned 15 on the 16th. And so I haven't been that involved with, what the left is saying, but so far it just feels like a great energy and we're all excited. But I think this also speaks it also speaks boldly to the fact that the Bible tells us, Jesus tells us, that those who are called according to his purpose, that he is doing that. And that prayer and submitting and asking God to heal our nation, turning away from our evil ways. And, he says that he will hear from heaven and he will answer us. And having Donald Trump and his appointments so far, there is a lot of hope I see and feel. I'm also very careful to be discerning. And I encourage all of you guys to do that as well. We can't give our hope in one man, right? I do feel like Trump does understand that like he has been kept alive to heal our nation and to help people come back from God. Rabbi Jonathan Cahn from Hope of the World, one of my favorite rabbis, teachers, he speaks of Trump as like Jehu in the Bible. And that's a very interesting take on Trump and the trumpet sounding. And I just think it's very cool. So you guys enjoy this show. Please reach out to us. Go to nursesoutloud.com and give us, your name and your email address so we can be in touch with you guys. We want to interact. We are planning on doing a cruise here next year and doing some more teachings and stuff. And so enjoy the show and let us know what you think. Welcome to Nurses Out Loud, an uncensored platform for everyone who aspires to live life with moral courage. We are nurses with high ethical principles and integrity and take information that is not mainstream and bring it to light. Many people are not aware that big pharma companies donate to our media, government, and educational institutions. Therefore, studies are extremely biased, and that is what the media reports. Scientific discourse is paramount, and we have a listener who sent us their flu declination form from their employer last night, and they wanted them to sign it. They were having strong ethical and religious issues signing it, and they asked for our opinion. So we got together real quick. Today, weighing in with me on this is nurses Michele, David, and Ashley. We have 9 points that we are going to go through on this form, and I will read it, and then we will all weigh in as briefly and succinctly as possible. If you guys have more questions, comment, and we will certainly do another show. We're also considering doing some live Twitter spaces as well. So we just want to know if you guys are interested, and we for sure will do that with you guys. So we're going to understand the form, okay? We are going to deal with ethical perspectives in each of these points, religious considerations, informed consent, navigating your conscience. And I think this is a timely discussion because we are at that time of the year where that little cart goes around in the hospital wanting everybody to get injected. So here we go. Their first point so the form says this 2024-25 Influenza Vaccine Declination Form. My employer, blah, 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 recommends that I receive influenza vaccination to protect myself, patients, staff, and others in the healthcare facility. I acknowledge that I am aware of the following facts. Please read and check each box. First one, influenza is a serious respiratory disease. Each year in the United States, influenza kills thousands of people and causes hundreds of thousands of hospitalizations. Who wants to go first?
Well, this reminds me a lot of COVID, actually, because people who get influenza when it's fatal often die of a bacterial infection that's secondary to the virus that they caught. So it's true that COVID kills some people, especially the vulnerable. It's true that influenza ends up killing some people, especially the vulnerable, but it's not necessarily a direct path like they imply it is. It's often through a bacterial infection that this ends up being fatal.
Mm-hmm. All right, so Michele.
Yeah, my thought was if the CDC that's supposed to be concerned with the welfare of the people, we're actually teaching nasopharyngeal sanitation to the American public and just simply informing them that using saline and saline in your nose and gargles through the flu season could very seriously cut in half your chances of even getting the flu. But if you took it a step further and taught them about the benefits of the iodine in the nose and the throat, it would be a game changer. We would not be having the kind of medical conditions that we're having right now. We wouldn't have secondary pneumonias if we could actually knock out while it's in the upper respiratory right at the beginning from the nose and throat. It would be a game changer. The question is, why are they not educating? Because you can find that stuff on the NIH and CDC website, but it's not being taught.
And for those of you that aren't aware, Michele, I met her, Nurse Michele, I believe in 2021. And she is the snort, gargle, rinse girl. So you
snort, gargle, nebulize.
Yes, there you go, man. She is all about the upper respiratory tract. She's my go-to person. Okay, when I need some research and stuff, she's my girl. So yeah, Ashley.
I was just gonna wait until the next one, so let's go ahead and roll into this next one. This is good.
Yeah, no problem. So I'm gonna weigh in on this. So we said yes, there are different severity of illnesses, and some studies suggest that cases are mild and self-limiting. What does self-limiting mean? That means the condition resolves on its own without the need for medical intervention. And in the context of influenza, there are cases that are mild and improve without treatment. So for them to say that everybody needs to do this, the actual risk varies year by year and by population. Okay, moving on. Second one. Influenza vaccination is recommended for me and all other healthcare personnel to protect our staff and our faculty's patient from influenza, its complications, and death.
So first of all, can we say fear tactics? This blows my mind because, okay, let's just pretend that influenza killed on its own and you didn't have to be immunocompromised or have a bunch of comorbidities or other illnesses like high blood pressure, asthma, emphysema, COPD, heart failure, etc. If that were true and the vaccine actually worked, those people getting it would be protected and they wouldn't need me to get the flu vaccine to protect them. Plus, we know that as years go on, they talk about a universal flu vaccine and the fact that you wouldn't want to give it to an 80-year-old person. You would want to give it to the very young because the body develops immunity, and that cross reactivity or the recognition of different viruses is there. So that natural immunity, building that natural immunity up while you're healthy, while you're young, is actually beneficial. And we know that the flu vaccine is not effective. In fact, if you go look at the CDC website, you can see over the past 10 years, I even gave them the good grace of removing, 2020, 2021, the effectiveness of the flu vaccine over the last 10 years was an average of 37%, removing 2021, 2020, 2021. With it, it's 32%. So the vaccine isn't working. It isn't protecting people like it's intended to. And so what's to say that I'm going to get this vaccine and I'm not still going to get sick and pass it on to other people? I have a false sense of security.
Mm-hmm. What would you say to those people that say, well, 30% of people are better than 0% of people?
I would say, what's placebo effect? I mean, seriously, let's talk about that. Placebo is a very powerful tool, and I used to think that it was only around 30%, which is still high because the flu vaccine is about, average 32 to 37% effective. But I actually read a study in Science of Translational Medicine, and they were researching migraine, and it was up to 50% effective as, quote, the real drug to reduce pain after a migraine. 50%. So placebo is just as effective.
Mm-hmm. Mm-hmm. What's placebo, Ashley?
I'm so sorry. Placebo is typically an inert or inactive thing. So like you think of sugar pill, or maybe it's a sodium tablet, something that has no real effect. Saline, it's inert. It doesn't do anything. So it's not doing anything to help you or to protect you. It's all a psychological response.
Mm-hmm.
So,
okay. David?
Somebody might say, well, 30 some percent, that's still really important if you're a healthcare professional and you're working with vulnerable people. Like 30%, that's not negligible. And a lot of those same people who are still getting every single COVID booster and who are getting their flu shot every year, they'll kind of defer to the CDC. Like, well, this is what the CDC says about this, and this is why my hospital is doing it. So this is why I think that everyone should do it. When you look back at the CDC's own data on the effectiveness of the flu vaccine, I'm going to pull out 2017 in particular. So they had a trivalent vaccine. Every year they do the same thing. They say, well, it's going to be a really bad flu season. It's really important for everyone to get their flu vaccine. And then they say, well, we picked the wrong strain, so that's why the flu season is so bad this year. But if we had more vaccine uptake, it would have been a lot better. So everybody next year, be sure to get your flu vaccine. It's the same playbook every year. Back in 2017, the trivalent vaccine made you more likely to get the flu. It increased your chance of getting the predominant flu strain that did cause fatalities. So the flu vaccine literally increased mortality that year. And yes, I cherry picked that year because it was so bad, but there hasn't been a year where the flu vaccine has been wildly effective. And of course, every time you get the flu vaccine, you are opening yourself up to side effects, some of which can be completely life-changing and fatal. So again, to the people who prefer to defer to the CDC, go on the CDC website, look at 2017. Yes, it's an outlier. Look at other years too. Like the flu vaccine does not have this robust evidence base where it's just the greatest gift to humanity that we've ever seen. Like this form pretends it is. The scaremongering in this form is not evidence based at all whatsoever.
Mm-hmm. Yeah. And you have to remember, guys, these reporting to VAERS are for injuries are extremely low. They say less than 1% of people report their side effects and their symptoms to VAERS. Probably about the same amount, I would say, don't go to the hospital to get tested when they're sick. They just stay home. So we don't even know if they are, if they took the vaccine and they got the flu, because they're not reporting their sickness to anyone, right? So we have to remember that. And then another two huge points to make, I think I want to, is autonomy. We have the right to decide what is best for ourselves. Okay. This whole idea of doing it for the greater good is literally a World Economic Forum, one world government agenda propaganda line. Okay. So just don't let people kid you with all of that. Like, if they really cared, they would do everything they can for people to not be obese, and they would start in our food supply and our grain supply and our water supply. Okay. So I don't even want to hear that from anybody from the government. And then we also have risk stratification. Okay. Each of us make our own choices. That's essentially what that is. So on with the next one. If I contract influenza, I can shed the virus for 24 hours before any influenza symptoms appear. During the time I shed the virus, I can transmit influenza to patients and staff in this facility and possibly cause them to die. I mean, they didn't say it on that one. I was just adding to the one prior. Michele?
Yeah, I think it's very interesting that somebody says you can spread a disease that you can't have any symptoms in your nose and throat. So if it starts in your nose and throat where you breathe all day long, I don't know about y'all, but if I'm even remotely in a cold or something like that, I feel there's always sensation. There's always something. Your body used to being in a state of homeostasis. Now it's not, because something's out of whack. You sense it. You're starting to sneeze. Maybe you're dribbling. Maybe you feel like something is going down the back of your throat. You have a little dry hack or something. Something is going on. And that is your first indicator that if you're a medical professional, you should be utilizing nasopharyngeal sanitation in your nose and throat, because you think you might be getting something. You don't want to share anything, but you might not be sick enough to not go to work. You go to work anyways. You should continue your nasopharyngeal sanitation in the workplace. But if you come down with a fever the next day, well, now you know you really got something. You should be staying home and continuing with good therapy regimens that are going to keep you from getting further sick or progression into secondary illness.
All right. So, viral shedding. I mean, while it's true that individuals can shed the virus before symptoms appear, the actual infectiousness, right? What we call it in the medical field, clinically sick, right? And transmission rates can be variable and depend on numerous factors, including the specific strain and the individual immune response. So, as Nurse Ashley was saying earlier about increasing your immune system, right? If we have a robust, strong immune system, it's going to fight it off before it can take effect and other people can get sick from it. Okay, next one. Oh, go ahead. Sorry.
I was going to say, on this point, there's another bait and switch here. They were doing this for years with the flu vaccine, and then they did it again for COVID. And the bait and switch is the common understanding that people have about vaccination preventing a virus, where they would say, oh, if you get the flu vaccine, you will not get the flu. And people think of that as, well, I won't get the flu virus. As it works in reality, what they mean is you won't get flu symptoms and hospitalization, but you will still get the virus. We see that from all these breakthrough flu infections that we get. You still carry and transmit the flu virus to other people. So this talking point that they make about you need to get this to prevent the flu, it doesn't mean prevent getting the virus at all. Just like that bait and switch they did with COVID, where they told us if you get the COVID vaccine, the virus stops with you. No, it never stops with you. You still get the virus. You can still transmit the virus. They've done studies that look at flu viral loads, just like they've done studies that look at COVID viral loads. You still get and transmit the virus even after vaccination.
Yeah, so that's a good point talking about the flu vaccine or the COVID vaccine. And guys, step in here and help me out if I mess anything up. But essentially, let's look back at it. We had the strain, the 2020 strain, okay? We injected everybody with just the spike protein, okay? Not the entire, and plus it's never been isolated in its entirety still, but it's just the spike protein, okay? There's other elements to this virus other than the spike protein. So we inject them in there with that. The strain is still going throughout the world, right? They even say in Virology 101 that you should never vaccinate during an outbreak because it has the opportunity to vaccine escape, which means fail, okay? Essentially. So they gave that one shot, and then they were like, oh, wait a second, it's mutating. It's not helping people anymore. So then they give another shot. We're on shot 10. Every 6 months, they're coming up with another shot, guys. So the influenza is essentially the same thing, except they only do it yearly. Okay. And they take their best guess. They only take like 2 or 3 strains and they put it into one, but there are millions out there. You see what I'm saying? So, they're saying these are the predominant ones that are circulating. So we're only going to protect you from those. All right. Where there's a lot of discussion to say that if you just get it if your body doesn't fight it off and your immune system doesn't fight it off and you get it naturally in the wild, okay, you get the entire virus and your body can develop an immune response based on that. So they're saying like a lot of people that had flus back in, I don't even remember what year or whatever, but they were protected from the SARS-CoV-1 or something, right, guys? Anybody want to help me out here?
Yeah, I can actually address that. In 2003, our whole family had the most drop dead flu we'd ever had in our entire lives. And I had a nursing baby at the time. Everybody, my sister was there with her 6 kids. I was there with my 5 kids, and my brother was there with his 4 kids. And people started dropping literally to the ground, unfunctionable. And I'm thinking, I'm going to hightail it out of there. And as I am trying to pack up as fast as I can, I had to crawl to the bed because it was like every ounce of ATP of energy in every cell in my body was on 0. And I mean, my mother brought up a baby to me to nurse it. It was like a leech because I mean, I was unconscious. That was apparently SARS-CoV-1. And then 17 years later, that baby's 17 years old and we have SARS-CoV-2 hitting. All those kids who got it during that particular season, they all were shooting basketball by 3 days later. So is that why they were able to do so well? I ended up still in the COVID unit, but I'm also a high risk person. So we always know the vulnerable people among us are going to be the more vulnerable always. The elderly, the people with lung conditions or compromised immune systems, those are going to be our vulnerable people. We should be educating them. If we're educating them of ways to prophylactically prevent these kind of respiratory infections, I'm amazed at what's even being advertised on shows like Hulu. They are running commercials left and right about vaccines like it is candy for sale. So something's up.
Yeah. Ashley, did you want to weigh in on that?
Yeah, I think Michelle covered it perfectly, but it's just talking about the way that, like you said, they only use the vaccine for that one part of the spike protein. When they talk about creating a universal flu vaccine, they're talking about creating it for what they call the stalk, because it's just a part of the virus that doesn't change. Because as we vaccinate and as we put more pressure, these viruses are living organisms. What do living organisms do? They change based on what they need to do to survive. They are smart. viruses have been around longer than we have. And
Mhm.
so they are experts at changing so that they can live. And if we are hastening that process, we are speeding that process up by creating vaccines and vaccinating during an outbreak or a quote pandemic, then we're going to help that process right along. And as it becomes worse, it's going to spread or become more virulent
Mhm.
faster.
Mhm.
So we're creating more of a problem. And it's just wild to think about how smart our bodies are
Yeah.
and how quickly we adapt, just like viruses, because we've been coexisting with them for as long as we've been around.
Yeah.
God knew what he was doing.
Yeah, amen to that. Just a little example here, the antibiotic resistance. I don't know if you guys are hearing about that, but we have like MRSA and VRE. We have these really powerful bacteria that are escaping our, first line, second line defense antibiotics. And now we're having to do learning modules every year on antibiotic resistance, not encouraging people to take antibiotics if, it's a virus and they have to wait a couple weeks. Like, so if you're sick, I'll tell you as an ER nurse, if you're sick and you have a cough and you have a fever going on here and there, even if you don't take a test, the provider is going to wait about 2 weeks before they're going to give you an antibiotic, because that is protocol. So it's kind of the same thing, guys. Maybe we would just give antibiotics to the immune compromised or to the elderly and let the healthy people work it out. Right? Same idea with the influenza vaccine. Yeah, if we have healthy population, maybe, or unhealthy, maybe we want to give it to them, not encourage your healthy nurses and doctors to mandatory take it. I mean, this is absolutely ridiculous, and pushing it, and Michele just put in the chat, and pushing it on kids. We don't need to push it on kids that are healthy, right? So, all right, next one. If I become infected with influenza, even if my symptoms are mild or non-existent, I can spread influenza to others. Symptoms that are mild or non-existent in me can cause serious illness and death in others. Oh my God, death. Goodness gracious. Like, what is this?
I think it's all about the fear and all about the guilt. I can guilt and shame you into protecting your patients. When in reality, David talked about viral load earlier. Viral load is the amount of virus that has replicated in your body. And again, if you have a robust immune system, it's going to attack that virus and shut down the ability to reproduce or replicate in you, reducing your viral load or the amount of virus in your body. And you're going to clear that faster because, just like he said, even if you're vaccinated, your body was trained to create antibodies, the things that kill your immune system, that kills the virus. So you still have to wait on your immune system. So my question is, if we're sending people home and we know people like to do things, this is part of the reason placebo is so important and prescribed so frequently, is that they want to do something to feel better. Why aren't we telling them, yeah, here, go home, increase your vitamin D, double your vitamin D dosage for 3 days and increase your vitamin C to bowel tolerance, like Dr. Suzanne Humphries talks about. That is how you can boost your immune system. That is how you can stop replication or reproduction of virus. And that is how you end that viral load and have less likely ability to pass it on to others.
Mm-hmm.
I would say that the way that we end up with maybe killing somebody is having lived in a home with 6 kids and 2 grandbabies at one point, that 10 people were living in our house. And you had 2 of those babies going to daycare on a regular basis that were going into homes who, let's say, don't practice appropriate nasal pharyngeal. They don't take care of their kids when they're sick with snotty noses, and they send them to school. And all those children are, RSV is very prevalent during that time of year, and it's snots on everything. And those kids come home to the family who may be practicing good sanitation in their home, but people who hack lung and don't cover their mouths when they're sick, and just cough around everybody or don't isolate. The whole idea of quarantining a sick person is a good idea. I mean, I've had 6 kids my whole life doing this. And what we do when somebody's sick, they get the privileged little VCR TV that gets a stack of VCR videos and a video in their room. And we give them everything serviced right at the bedside. And you are going to have the heyday of your life. The window's going to be open. A fan's going to be blowing out of your window. And we are going to make sure you're following the protocol. If you leave that room and start walking all over the whole house, hacking lung and rubbing your snotty nose everywhere, yes, you're going to get grandma sick. But if grandma's using iodine nasal pharyngeal sanitation and nebulizing after you leave her house, she's probably going to be good.
Mm-hmm. Yeah.
Yeah, this is just so manipulative. It's just trying to guilt trip people into getting the flu vaccine. And another one of the manipulations we see very commonly with the flu vaccine is you will be told if you don't take the flu vaccine, you have to wear a mask while you're at work, which is, again, no evidence base for that. It's completely manipulative because people don't like wearing masks. And if anybody has an employer who's saying if you don't get the flu vaccine, you need to wear a mask at work, show them the box. It will say right on the box that this mask does not decrease the transmission of respiratory viruses. And it's also going to say that you shouldn't wear it for more than 4 hours. What those masks are made for, those cloth masks that we all wore forever in 2020 and 2021, they're for surgeries and they're to stop things like hair and spittle from getting into a surgical incision. They were never for stopping transmission of a respiratory virus. This is something that was studied ad nauseum after SARS back in the early 2000s. They did an enormous amount of work studying viral transmission, including with these cloth masks, and they just do not work. The CDC knew that before COVID. It's on their website that they knew that these masks don't reduce viral transmission. So it was,
and that's why you had Fauci and the Surgeon General come out in March of 2020 saying we're not going to wear masks. We're not going to be a nation of mask wearers. Masks do nothing to protect you from a virus, quote unquote. Right. So they knew. And that's right. You know, that you brought that up. I had just had to get fit tested for my N95. And when you get fit tested, you put the mask on, you put a hood over, and then they squirt some saccharin, sweet stuff into the hole. And you have to tell them if you can taste it. And you're moving your head, you're reciting, you're doing some work, you're moving around. And I had my glasses on and I, took my glasses off. I put the mask on. I, squeezed it to my nose, molded it to my face, put my glasses back on, and I was tasting it. And we're like, wow, well, how am I tasting it? Now, guys, this is an N95, okay? It was just a simple thing. My glasses just touched that mask and it created one little tiny opening you couldn't even see. This is how aerosols work. Okay. So yes, Ashley, do you want to address that now, or do you want to wait for religious? Go ahead.
So with this being a punitive measure, I really encourage people. I'm going to sidestep for just a second. With the religious exemption, you stand solely on religion. And we did a show end of September, I think it was the 28th, on this topic. But you stand solely on religious. But people need to start refusing and calling this out as religious discrimination, because the only reason they are making you wear a mask is because you're not doing what they want you to do and taking their vaccine. And we've already talked about the low effectiveness of this, vaccine, the fact that it really doesn't work. It's not preventing, you getting it. It's not preventing you from having the virus in you or sharing the virus. And so this truly, and the masks don't work, this truly is punitive. So this is where you could turn that argument around and say, I'm not getting the vaccine based on my religious beliefs. But in addition to that, those that are taking the vaccine, they are just as likely to, number one, have the virus in their body. And number two, if we're looking at placebo, they could spread it just as easily. So fighting this from a religious discrimination standpoint, you can stand on the science of the fact that masks don't work and say, this is punitive. You're discriminating against me based on my religious beliefs, and you're exposing those beliefs to everyone around me. And that is harassment. And this is how you work through the EEOC, or Equal Employment Opportunity Center. So really, truly, we got to start pushing back on this and saying, no, I'm not wearing the mask. But it is going to be a fight, and you're going to have to push.
Yeah.
That's
a good time. Oh, Michelle, go ahead.
To anybody out there listening who feels like you are in such a distressful situation that you got to have help, and somebody really professional, and you're willing to pay for somebody to help you, Peggy Hall, the Healthy American, look that up online. She's ready to fight for you. All of you that are out there in California, you have such incredible communism there. She's living there in California. She knows exactly what you're up against, and she knows the wording. But don't forget this particular phrase, whether it pertains to any vaccine or whether it pertains to the mask. This letter serves to notify you that I am invoking my right to religious accommodation under Title VII of the U.S. Civil Rights Act. And you can add in there, as it pertains to your vaccine mandate or as it pertains to your mask mandate. You are not asking permission from your employer. You're invoking your U.S. citizen right. And just start acting like you believe that, because they've dumbed us down to believe that we have to grovel at the feet of our employer, who is ignorant. So they're ignorant. Give them some U.S. constitutional knowledge, and just stand there until they give you your declination form.
Yes. And we're working on a Nurses Out Loud website right now, guys. But in the meantime, go to nurses at, you can go to americaoutloud.news/nurses out loud. And you can also send us an email to nurses@americaoutloud.com. And we will get back in touch with you. Each of us here on Nurses Out Loud, and so many more, are doing amazing things that we really want to make the public aware of. And so I want to just give my little thought on this little statement. So they're saying, let me read it again. If I become infected with influenza, even if my symptoms are mild or non-existent, I can spread influenza to others. They want you to attest to that is true. That is false. Okay. Can you? It's kind of hard, right? It's like nothing is impossible, right? But is it, has there ever been a pandemic based on people who have no symptoms? No. Has there been outbreaks for people who have no symptoms or mild? What's mild symptoms? Mild symptom would be a little congestion. Are you going to kill somebody by having a stuffy nose? Mild would be a cough that happens, every now and again. Are you going to kill somebody because you're coughing? I mean, this is like insane to me, especially if you are following proper hygiene and infection control measures. Number one thing you could do is cover up your cough and your sneeze in your elbow, like that. Okay, just in your elbow. Very easy. Don't do it on your hands, because now you got to wash your hands. Do it in your elbow. Do it in a tissue. If you do it in a tissue, then you got to wash your hands after you throw it away. But like Michelle said, the nasopharyngeal sanitation, and we like Immune Mist. We were making our own in 2021. Okay, but Immune Mist has made it affordable to have small travel size containers up to 250 doses for like $20. Okay. It's a no-brainer to have something like that on you. I have it in my bedside. I have it in my bathroom. I have it in my purse, and I have it in my truck. Okay. I have it. So next one. I understand that the strains of virus that cause influenza infection change almost every year. And even if they don't change, my immunity declines over time. This is why vaccination against influenza is recommended every year. My immunity declines over time.
Where'd they get that science from?
Yeah, I don't know.
Yeah, last time I checked, this is quite amazing that for somehow we are to believe, been led to believe that we are these machines that are being pumped out that need to get little things put inside of us all the time to make sure that we survive on this earth. But it is amazing how all of us came into existence with all these pre-vaccine era
Yeah.
lives. I mean, yes, a lot of people died of things, but it was because of sanitation. It was
Right.
because of, lack of refrigeration. It was because if you do put your outhouse over near where your well is, there's a good chance your water supply is going to be a little bit of a problem for your family. So people have learned things like this, but it was known even in biblical times that there were sanitation methods that needed to be done. And during the Black Plague, I believe it was the Jewish population that practiced kosher methods that were able to survive the Black Plague, whereas the people in the community that were, let's say, living more of a Gentile life at that time and tossing their urinals out onto the city streets, that caused a bit of a problem.
Mm.
So it says that this is why vaccination against influenza is recommended every year. No, that's not why. It's recommended every year because it's a multi-billion-dollar industry for which the manufacturers have no liability. And they own the people who promote it. They own the mainstream media companies, and they make millions and millions of dollars in donations to the hospitals who make their staff do this, and the other industries that make their staff do this. That's why it's recommended every year. It's not about being evidence-based. It's not about population health. As we've talked about before, if it was about the evidence, then we would know a lot more about these things than we do. If it was about population health, then we'd be talking about vitamin D and vitamin C and promoting your immune system and getting PFAS out of our water. And we'd be talking about ultra processed foods, and we'd be talking about sugar, and we'd be talking about all those things. But we're not. Instead, we're just told, roll up your sleeve again this year. Maybe this year we'll get the strain right. Maybe not. Who knows?
Yeah. 100%. All right. Yeah. I there's studies, they say that immunity can wane. I think vaccinated immunity can wane, but if you get it naturally, again, I think your immune system is more robust and can fight it. So yeah, so there's that. Even before I became a nurse, I remember getting the flu vaccine, and I thought I was just doing something good for myself, and I would always get sick. And I was like, why do I keep taking that damn shot? I always get the flu. And then they look up and they're like, it's impossible to get the flu from the flu shot. And I'm like, yeah, I don't think so. There's something called intuition and street smarts, right? Guys, like, don't let them take it away from you like they did with COVID. All right, next one.
Absolutely.
How
Oh,
many
go ahead.
mothers
What, David?
I was going to say, it's one of those things just like COVID where they said, don't believe your lying eyes. It's anecdotal. Those breakthrough infections, we don't have population level data for that. And, they told all of us to not believe our lying eyes. And then, years later, it starts to come out just how common breakthrough infections are. And they knew back then. They knew that in the clinical trial they didn't test for transmission. We've gone deep on that on prior episodes of Nurses Out Loud, so I'll just leave it there. But it's another incident where trust your gut, just like you said, Jodi. Like when they say, "Oh, that's anecdotal," there's no population level data of that. Like, yeah, that's a big red flag for they're gaslighting you. They're lying to you.
Yeah, 100%. What Nurse David is talking about is we did a show on the 21st called the Pfizer Papers. And what that did come out and show is that in November of 2020, they knew that it didn't stop infection or transmission. That's what they did. I mean, they knew that at that time. And Nurse David is right. Remember how they said, breakthrough infections or vaccine escape. That was the failure. It was failing. It was not working, guys. They just changed the words to confuse you. And here I remember, this is one of my whistleblower allegations, right? And I'm remembering, I'm looking around at everybody and I'm like, dude, just got shot up like 2 months ago. He had COVID last year. Why is he sick? And everybody's getting sick in my hospital. Everybody's going around. 24-year-olds on Holter monitors, people dying, like all of these things. And I was like, anybody, like, you think it's not working? And then now, we wonder why the FDA wanted 75 years to release it, and people are like, well, why did the FDA decide that? Why wasn't it Pfizer? Well, it wasn't Pfizer because Pfizer pushed the buck over to the FDA to get the EUA. And FDA is responsible for the EUA. So they needed to know about the trial in order to, grant it that stamp of approval of emergency use authorization, right? So that's why the FDA was up on the stand. So yeah, check out that show for sure, for sure. All right. Where was I? I know. Oh my gosh, we all have so much to say, don't we? All right. Let's see. I said immunity decline. Okay. I understand that it is impossible to get influenza from influenza vaccine. So they say, I understand it's impossible. They want you to attest to that. Could you attest to that?
Absolutely
David
not.
needs to include what he did in his recent paper, which everybody just needs to hear. It's a great idea to just put not applicable as instead of an X or a circle, just putting in a there because that's not applicable.
Mm-hmm. Yeah. We're going to talk about how to fill out this form and or how we will. And I agree with you, Michelle. Ashley, you want to answer that?
Yeah, I think this is where you like to say words matter, right?
Mm-hmm.
So I don't know if it's impossible for you to get the flu from the influenza vaccine. If maybe you were getting a live, I would definitely be able to argue about that. However, irrespective of whether the flu vaccine actually gives you the flu or not, you can get sick because your immune system is activated. You've just had toxins shot in your body designed to stress your immune system. So while your immune system is fighting off the flu vaccine that you got in hopes that you potentially build antibodies, which history shows us you're probably not going to, what is that going to open you up to? So are you getting the flu per se? Are you getting a different kind of respiratory infection? Is there something else that happens? Absolutely. So I don't even think we need to argue about the flu in particular or whether or not it creates flu virus in your body, because with standard, traditional flu vaccines, it doesn't create the flu virus in your body. It injects some of it in there. It's not supposed to replicate. It's not supposed to be able to grow, but any live virus comes with that risk. And that's why they say if you're immune compromised, you're not supposed to get it. But absolutely 100%, these vaccines do challenge your immune system, which can make you more susceptible to the flu or other illnesses circulating.
Yeah, I'll just jump on that to return to my previous point about how even the CDC acknowledges that some years the flu vaccine increases transmission of the flu and makes people who get the flu vaccine more likely to get the flu. So, they're making people fill out this form that says, I understand that it is impossible to get influenza from influenza vaccine. Okay, for people who do get the influenza vaccine, are they having them sign a form that says, I understand that some years getting the flu vaccine will make me more likely to get the flu? No, of course not. They're not having them sign that form.
Yep. Yeah, I'm right there with you. I mean, while it's generally accepted that it does not cause it, there's individuals that report side effects, right, that they associate with the vaccine, and that's what leads people to concerns about the safety and efficacy. Just me, 20-year-old Jodi. It's like, why do I get the dang flu every time I take the flu shot, right? How many of you guys can relate to that? I know there's a ton. So that's exactly what that's saying. All right.
It seems that they should actually add the clause that says, I know that if I do accept the requirement and get the vaccine, I still may get the illness that I'm getting vaccinated for. They should add that clause to it.
Right. All right, here. The consequences of my refusal to be vaccinated could have life-threatening consequences for my health and the health of everyone with whom I have contact, including my coworkers and all the patients in this healthcare facility. Wow. All the patients, guys, life-threatening consequences.
That's bullying if I ever heard it. That's making you feel like you would be responsible for every respiratory illness in the entire hospital if you don't submit to their policy.
Yeah. Yeah, I think we've kind of hammered that home. Well, we are going to be putting these out in clips, guys. So if this is the one clip that you're seeing, make sure you're following us because we're going to put these out in short, digestible clips. But essentially, David, I want you to just answer that. You know, you're our resident psych nurse. Is there some psychological, brain, whatever I'm talking about?
Oh yeah, absolutely.
Manipulation.
Yeah, oh, absolutely. This preys on the good nature of people who are drawn into a career in healthcare. Many of the people who become nurses are very disproportionately empathetic personality types, and this is predatory on people who have an empathetic personality because they want to take care of the people around them. That's why they became nurses. That's why they became doctors. That's why they became CNAs. They are the helpers. They are the people who just feel this strong connection to their fellow human beings and they want to take care of them. And so this is incredibly manipulative to them because the last thing that they want to do is do something that hurts someone, that hurts a coworker, that hurts a patient. And it is in complete contradiction to the type of narcissistic and sociopathic personality that it takes to be at the head of a pharmaceutical company or at the head of one of our federal institutions. This is an incredible black and white dichotomy that we see. We see this over and over and over again with all these pharma scandals going back decades and decades and decades. The people who have their careers thrive in pharma and who make it to the top of our federal institutions are absolute sociopaths. They kill people for profit. We know this from the class action lawsuits where we happen to learn a little bit about their predatory behaviors. We have so many lawsuits that are settled under wraps where we don't even get to see how awful these people are. But when you look at the Sacklers, when you look at Vioxx, when you look at Purdue, when you look at SSRIs, when you look at Pfizer, like these are criminal organizations. That is their business model. It is to profit off of people, and if they have a product that happens to kill them, that's just fine to them. And it is in direct contrast to the people who are at the bedside in our hospitals who really, truly care about people and who got into that career because they care.
Well stated, David. Well stated. Gosh, we just love our new nurses, don't we, Nurse Michele? This is Nurse David and Nurse Ashley. We also have Nurse Nicole didn't join us today. Like I said, we all just did this very quickly because we understand the importance of it. But right, aren't they just stellar? I love the new energy.
Yeah. Incredible value. I am so thankful for all three of them. They're just amazing. And the insight that David just shared is just incredible. I pondered whether or not, David, you would weigh in on, the Myers-Briggs testing and testing similar to that is used to help employers make sure they have the right kind of personality for certain job positions. You've got to know that at the level of CEO management for what kind of personality type do we need to run a hospital? Somebody at some level has said, which personality type is going to be able to make all these impasse submit so that we can get the most amount of money from the government? Because if we have certain percentage of our employees get a certain percentage of the vaccines every year, we're going to get this much more money in every year. Whereas the people who are the impasse, the other personalities that are out there trying to help the people are being the ones bullied into that. I'm sure there'd be a really good investigation to do to find out at what level has is it in the schools that they're teaching for the business majors numbers, etc.
Well, you know what's interesting? You bring that up, Michelle, is there's a site called Truity, TRUITY and .com. And there was a little the fun little thing that we were doing in our hospital, and it's called the Enneagram test. And we sent it out to everyone, and we all got what our numbers were, and mine was spot on. And I sent it to my family. We're going to throw the link in there to in the show notes too, because yeah, it's cool. There are personality traits and characteristics that make you more like, are you a change agent? We kind of need somebody who's innovative, but not too much, right? We don't want you to be too mouthy.
It's crazy.
Go ahead, Ashley.
I'm just going to mention the fact that this goes so deep. We use motivational interviewing, and a lot of people, I think, in the healthcare industry have been introduced to this. And a lot of what they do with these vaccine compliance, vaccine hesitancy videos is teach motivational interviewing. It's about asking the right questions to steer the individual that you're working with into coming to that conclusion on their own. And when I worked at the insurance company, this job morphed into data mining and behavioral modification just to fit the, predetermined, quote, preventative maintenance or follow-up. And so the patients were broken down into 16 different categories. We had the description of what their personalities were like, examples of what they would say, and how we should counter that. And we had this massive training, and we went through this and we repeated this, and we had smaller little bits of training and role play on how to manipulate behavior through those conversations. And so being able to overcome that, I think that's why COVID and all the propaganda was so effective, is because they know how to manipulate different personalities in the ways that they need to. And they used all of those traits across the different media, breaking down people's sense of autonomy and breaking down their emotions and making them feel like they were going to kill somebody, and how horrible you would be for doing so. It's disgusting, absolutely disgusting.
It is. And you're right. If you guys can't tell by now, we have a lot to say. When I first asked them to come on, I was like, we're just going to do it in 20 minutes, guys. Well, so far we're at 53, but that's okay, because it is what it is. And we can speak on each of these sentences, statements for an hour. Easy, an hour. So we have those boxes that they want you to check off, and they want you to check them off, because it says, despite these facts, I am choosing to decline influenza vaccination for the following reasons: either medical reasons, religious reasons, and personal reasons. Now, I will have to give props to this company, because they don't need a statement. They don't need a doctor's form for medical. They're just saying, like, here you go. Like, you could decide, is it medical reason? Is it religious? Is it personal? Perfect. But at first I thought, okay, well, just sign it, check your box, and then turn it in. And then when I brought it to the nurses, Nurse David said, I would put NA next to each box. And I thought, absolutely, because you never want to leave a signed form blank, right? It's kind of even with our nursing notes when we would write something out. Oh, I'm not even going to go there because it's so outdated. But right. So just put NA on each of those boxes if you do not want to sign it, and then pick one and turn it in. At first I was so heated, and I was like, oh, we're going to get you all of this evidence. We're going to, write something beautiful, but, combating each of these statements. But at the end of the day, guys, I feel like, don't waste your time. Don't waste your energy on that. Simply just be confident and strong in your rights, like Nurse Ashley was saying, and then turn it in. Ashley, closing thoughts?
Yeah, just remember that, like Michele said, you have the right to an exemption. You do not have to make some big statement. You don't have to turn anything that's in on religious letterhead. That drives me absolutely crazy. I have helped thousands and thousands of people with their religious exemptions across the country. And it's not because I'm a religious authority. It's because you have a personal relationship with your creator, the universe, whatever it is. I actually, as a Christian, this was quite difficult. I helped a person who is a Satanist write their exemption because my duty in this role is to help people live out their beliefs. I don't get to choose what beliefs they have. I'm here to support them in making sure that they get to make the health choices that they want to do, whether I agree with the circumstances or not. And it's really about conveying that you have a personal belief and that your creator or whatever it is that you have belief in has endowed this upon you, and that it would separate that relationship. So for me, I would talk about the Holy Spirit, laying this on my heart, that I have prayed about this, and the Holy Spirit has made it very clear to me that this is not an appropriate choice for me and my religion. And so sticking with that very basic principles and knowing that they don't have the right, unless you give them reason to challenge your religious beliefs, you don't have to answer any of their questions. You can simply make that one line statement. It is against my sincerely held religious beliefs. My creator has, declared to me that this is unacceptable, and done. If they push you further, this is where you stand your ground. And this is where we take a very assertive stance. You are discriminating against me based on my religious beliefs. You send them that in an email, you keep your documentation, and then you immediately go file with the EEOC. When you say religious discrimination, most of the time they backpedal so fast you could hear it squeak, because that is a serious charge, and they know that if you continue to take this, you will win. And we have seen this time and time again, but you have to notify them that they are breaking the law and committing religious discrimination. You have to file with the EEOC, and you can hear more about that on that show Jodi and I had done on flu mandates last month.
Nurse Michele? No. Nurse David?
So I had an experience with a form very similar to this one a few years ago. And I guess the first thing I'll call out is that hospitals had a choice about how they implemented their mandates. Because of the Supreme Court case, hospitals did have to have a COVID vaccine mandate, but they could choose how they implemented it. So I am aware of a hospital that all they had was a checkbox. You could just check a box and you were good to go. That's how easy their declination process was. Other hospitals chose to come up with ridiculous forms like this that are full of absolute untruths and misinformation. They chose to put their staff through the ringer. They chose to challenge their religious beliefs, and they need to be called out for it. So yeah. When I got a form like this, I put NA next to everything because it was all untrue or not applicable. I was supposed to have a statement from a religious leader, and I put NA for that. And then I signed the bottom, my name, and I put under duress on there, and I turned it in. And it took them weeks to get back to me, but they accepted it. They didn't know how to
handle that, did they?
No, they did not know how to handle that, but it
because legally they knew that you could write every single word of it, and that you were basically letting them know litigation's coming your way. You want to mess with me on this, and they knew they couldn't.
Right. I wrote something that said something along the lines of, I'm aware that I have been offered a COVID-19 vaccine and I'm choosing to decline the vaccine because of deep and sincerely held beliefs. And they accepted it. That's not legal advice. That's not professional advice, but that was my experience.
The thing also, when they started asking my daughter's hospital that she was working at, asked 4 pages of an essay. It was unbelievable what she had to do. But I mean, I did tell people, like, if they say, reach out to your religious authority, you just put down there whatever deity's name you want to. You can say Jesus Christ, give him a call or whatever, because we are not going to give you some human man other opinion about what my personally held beliefs are. And when people dare to ask what religion doesn't let you take a vaccine, where in your religious book does it say that you can't have a vaccine, that would be equivalent to somebody saying, okay, you say that you're a woman, this person in front of me with a beard. Let me see if you have a penis or not. Okay, we're supposedly not going to be allowed to do that in this day and age. So if you can say, I am a gender of 70 different choices right now, I can darn well say to you that it's against my religious, my religious beliefs. The end. That's the end of the conversation.
Yeah.
They don't have a right to ask you all these questions.
No, and you know what? Even for religion, it doesn't have to be like, I like David's sincerely held beliefs, right? Period. End of story. And you could even, for me, if I was going to write something like that, my sincerely held religious beliefs based on my personal relationship with the father of Abraham, Isaac, and Jacob. Okay. How about that? You know what I mean? And just leave it. Yeah.
The thing is, we live in America.
Right.
We have freedom of religion.
Yeah.
I used to tell people, you could say that cat over there was your God, and
Yep.
nobody can question you.
Yeah.
That is the beauty of what we have here in America, is that right to religious freedom to believe.
Mm-hmm.
And it doesn't have to be organized religion. It doesn't have to be something that's written, because,
Mm-hmm.
What would they say to Navajo? Like,
Yeah.
how do you describe that religion? It's that
Right.
connection with nature. And so, yeah, 100%.
Yep. And David?
I was going to say, and for people who believe in the religion of scientism, who think that Fauci is a godlike figure, again, go right on the CDC website. You can fact check us from the CDC website about how effective the flu vaccines are and how and what the side effects are.
Mm-hmm. Okay, let's. I want to talk about CDC because this just blows my mind. Everybody is always talking about CDC says, and I go to CDC's social media pages. I mean, literally, guys, there's like 50 likes, maybe 20 comments, 5 comments, 100 comments. And if there are that many comments, it's people calling them out. So I do not understand, if we have about 5 million nurses and doctors in America, approximately, something like that, 5 million. How come just the nurses and doctors? What about the teachers and the people that, repeated CDC says, and they don't know a darn thing about CDC, these lay people saying that. I mean, seriously, this is so deceptive. It is all just propaganda and marketing, guys, that they are doing. And who are they? Well, right now, it's the Biden administration that is promulgating all of this stuff. Okay. And I don't care what you think, but, on, different choices that are on the ballot. What is on the ballot come November 5th is medical freedom, guys. Our Constitution is on the ballot. Our First Amendment, our Second Amendment, are up there. Our rights to religious and medical freedom and autonomy, and the right to bear arms against criminals that are out there. Like, this is on the ballot. This is it. I mean, you know what? Do you guys want to weigh in on that, and we'll close the show with that? Because I think it's important that we make our voices heard on that.
Yeah, there are only 2 candidates on the ballot. It's the Democrat Party and the Republican Party. And though they both may be corporations, and they may be a uniparty, even though that's true, if you're going to vote one way or the other, there's a party of the mandate and there's a party of the non-mandate. So the party of the mandate, it made you get your vaccine, or you would lose your job. You would lose your ability to participate in society. You would not be able to continue your education. Your child could not continue with their college. You could not come into certain places of public places because the Biden administration, the Biden-Harris administration, made sure that you understood you were going to be a super spreader, that this was an infection of the unvaccinated. So there was bully tactics. That is what you're voting for the next time some other system comes in. I'm not saying that Trump is innocent. He needs to account for everything that he should be saying. I validate that there are millions of injured people. The American public is being kept from private information, and I do expect him, along with RFK Jr., to go public. And if he does not go public with the level of damage and harms that has had, he needs to be held accountable to that as well. So either way you vote, this issue matters to 100% of the American population, because apparently 75% of the population did get at least 2 of these vaccines, and they did it under bully tactics by the government, and that can never happen again.
Yeah, I'm going to add right along to that. I mean, Michele was speaking a lot what's on my heart. Just for the record, that these opinions are my own and do not reflect those of, the people I associate or the organizations that I associate with. But for me, 100% what Michele said, it definitely, we need to see Trump come out, and he needs to take a hard stand. But when I'm looking at this from a perspective of my Christian views, of the way that I expect a leader to be from a level of the economy, I look at Kamala Harris and first of all, I'd be disgraced that that is the first woman who takes office. She has no policy. She has no backbone. It's ridiculous to listen to her talk, and it makes my head hurt because I don't know if she drinks too much. I don't know what's going on there, but something is not right. And then we've seen what Trump can do for the economy and how he's going to stand up for these things. They want to talk about abortion. They want to talk about how, Trump wants to ban abortion outright. That's not what he did. He turned it over to the states. That is constitutional. That is what is supposed to happen. He did the right thing in the scope of his office. Whether you want to be able to kill your baby or you don't, he did the right thing. That is up to the states. The states get to decide that. As a Christian, I cannot sit by and not bring up the fact that Kamala Harris just told people that they were at the wrong rally because they said Jesus is king. She said that during a rally. That just goes to show you that she doesn't think before she speaks. Everybody wants to point fingers at Trump and say Orange Man bad. What did she just do? She alienated a very large portion of the population. No, I'm sorry, you're at the wrong rally. That's the smaller one down the street.
But they clapped. There was a loud clap in that arena.
Well, if you get paid to be there, you sure will.
If you get statistics of what the percentage of religions there are in our country, I am sure she did affront the majority of the religions of this country, because there's no doubt Christianity is the larger denomination, the larger religion that's being practiced in this country. Even though I do believe it's on a decline, that she made a major offense, and that's a very divisive thing to do against a large part of the populace you say you're going to mutually represent.
Yeah, you don't belong here. Sorry.
Yeah.
It's really remarkable how the party that just a couple of years ago couldn't define what a woman is now running on women's rights. And you absolutely need to call out the way that the Democratic Party has used the issue of abortion over the years simply to motivate their base, to motivate voters, because in the time since Roe versus Wade was passed, there have been a multitude of times where Democrats had the presidency, they had a majority in the House, and they had a majority in the Senate, and they could have codified Roe versus Wade into federal law. They chose not to. Why did they choose not to? Because they wanted this situation that we have going on right now. They wanted it to be an issue on the ballot. They wanted to be able to go out and use abortion to motivate their base. And you know what? Back in the day, I was told safe, legal, and rare, and that I'm a guy and I'm not allowed to have an opinion on this. And I kind of went along with that for a while. And I can look back on 2016. I was a never Trumper. I also made fun of people for being anti-vaxxers. But my eyes have opened since then. And when I see them talking about doing abortions on full-term pregnancies, when I see what they're doing in the mental health field with kids with so-called gender-affirming care,
Mm-hmm.
these feel like biblical times. These things feel evil to me. That's again just my opinion, but
Mm-hmm.
things are being pushed so far. And is Trump a perfect candidate? Of course not. In fact, I think the biggest failing of his first presidency was that he didn't drain the swamp. He brought in people like Michael Bolton and like Reince Priebus and all these just absolute detestable swamp creatures into his administration. And this time he has Tulsi Gabbard and he has RFK Jr., who is the person I would put at the absolute top of the list to reform things like HHS, CDC, FDA, these completely broken federal institutions, much less the Justice Department, much less our intelligence agencies. We need a Justice Department that's actually going to do RICO lawsuits, organized crime lawsuits against these pharmaceutical companies, against these medical journals, against these institutions who are doing so much harm in the world for profit. And I believe strongly in the MAHA movement, Make America Healthy Again, because it is an existential threat. Whatever you think about vaccine safety or all these other things, it is an existential threat the way that autism is increasing, the way that autoimmune disease is increasing, the way that birth rates are declining, the way that cancer rates are increasing, the way that obesity is increasing, the way that diabetes is increasing, the way that we are in such bad shape as a country. Our lifespan is going down, not going up. And that is happening because we have absolute predators acting unchecked at the federal level. They own our politicians, they own our institutions, they are in control of everything. And they put profit over outcomes, and it is literally killing us. Our population would be in rapid decline if we didn't have millions and millions of people pouring over our southern border into this country illegally. And again, when you talk about good and evil, we have, what was it, 300,000 unaccompanied minors who have gone missing into this country. And that's a few years after we had Jeffrey Epstein commit suicide in prison, and none of the politicians, none of the billionaires, none of the celebrities, none of the scientists that he was trafficking children to have been held accountable. This is the most important election of our lifetimes. And is Trump a perfect candidate? Absolutely not. There are lots of very valid reasons to criticize Trump. But if we get another 4 years of the current regime, the current uniparty in power, they are going to tighten things up. They are going to tighten things up with free speech. That is another absolutely existential threat to Western society. So get out there and vote. This is an existential election.
Yes, 100%. I mean, the only thing stopping the new world order are Western values. And what are Western values? It's Christianity. And what have we done over the last 60 years? We have removed God more and more and more and more and more. And what happens to a world when God is removed? This is what you see. I 100% agree with Nurse David. I believe that we are living in end times. 2020, I was shooken to my core when I found out that the whole world was going to get on board with so-called, a virus. And I said, the whole world, well, the Bible tells us that everyone will be impacted. And I believe that was, that was a great dress rehearsal, essentially, for people to say, which am I following, faith or fear? Am I following, I'm going to kill grandma, I'm going to do this, that, blah, 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 and just get sucked in. It was like the poltergeist, right? Just those news medias, everybody's just sucked into the screen. And it's like, and we're looking, at everyone, and I'm like, no, don't watch it. No, don't pay attention, pray. So, yeah, guys, I mean, the Bible tells us, God tells us, as in the days of Noah, so too shall be in the coming of man. And for those of us that are believers, we are looking to meet him in the clouds. And I believe that the time is short. And so, just make sure that you understand your local policies as well, because I've heard this, that the president's office doesn't matter as much as it does what happens in your local community. And Nurse Ashley is really big on politics and making change and helping to bring legislation. And yeah, and Ashley, you want to say something to that effect real quick?
I'll try to keep it really short. I think we did a recent podcast on this too about local, or maybe it's, I think this one is coming up. We're going to be doing one on Nurses Out Loud about this. The impacts of voting local. Make sure that even if you go in and you're punching a straight ticket, Republican, Democrat, whatever, betting Republican, but you check those next pages of that ballot, and you can go online and you can find out who's going to be on your ballot. Look at them, because the federal level gets a lot of attention because they make these big, not only what happens across the nation here, but our foreign policy, our currency, all of those things. That is where all the glitz and glamour is. But as you get closer to home, those elected officials, whether it is at the state level, your state has a Senate and a Congress called a House of Representatives. And then you also have those local offices, your county commissioners, county council. These can be called different things, but you have a county and city government that you really need to be paying attention to, because they make most of the decisions that matter to you: taxes, zoning, housing, what happens with your water, what happens with your school board. So important. So go look at those things. Don't just vote on the federal level. These smaller races are very small fractions of people make these decisions because a lot of people don't pay attention to it. So make sure you're investigating those local races: school board, city, county council, county commission, and then your state level legislators as well.
Yeah. So for Arizona, for example, that's where I'm at. If you went to azleg.gov, that's short for Arizona State Legislature. You type in ballot measures 2024 analysis, and it tells you all of the bills, all of the propositions, and it gives you analysis so that you can be more informed when you go to vote. And very important, because you can have counties that are free, right? We saw that. We saw that in 2020, 2021, where there were counties in Michigan too, that were like, you know what? Yeah, okay, Governor Whitmer, they called her a witch. That's why, because she was so tyrannical that they came up and they rose up against her, and they were like, if you ever do this again, just know that we are a free county and we're not going to follow along with your stuff. So that's the power of local. So thank you, guys. You have been listening to Nurses Out Loud, and we are on air 5 days a week on iHeartRadio. I download the America Out Loud Talk Radio app, and you can listen to 24/7 programming. All of our shows also go to podcast about a day later, and we are on Spotify, Pandora, Stitcher, Apple, all of them. And be aware that we are having our own website, but we do have a merch store now. And the merch store, what is it, Ashley? Do you have a link?
We're gonna have to put it in the show notes.
Okay, we'll put it in the show notes, but these are some ways that you can support us. We're also going to, show you some of our sponsors. We'll put our hype link down here, and you guys can support us that way. So thank you, guys. Until next time, be safe, be well, and God bless.